May is Mental Health Month, and it's a popular topic of discussion in the media and a major concern during this pandemic. Spectrum Health's goal is to provide support and to educate the community with available resources for folks who may be dealing with mental or behavioral health issues. We are joined today by psychologist Lyndsay Volpe-Bertram and physician assistant Kristin, who specializes in psychiatry. They're with Spectrum Health Psychiatry and Behavioral Medicine Clinic, and it is good to have both of you with us. Let's talk about what we should all be looking for if we want to spot somebody, identify someone in our lives who may be suffering right now. Are there signs and symptoms?
Yeah, so some of the first signs and symptoms we typically see are people who are not acting like themselves. Sometimes they're isolating. They may be falling behind in work or their household chores. They may be not taking care of themselves, like not showering as often or not brushing their teeth. They may be eating too much or too little or sleeping more.
You mentioned that, we're in this pandemic. We are isolating ourselves from other people. How have you seen these times and the circumstances of today impact people's mental health?
Yeah, absolutely. So I think anxiety is really one of the predominant emotions we're having multiple sessions about per day because there's so much unknown and so much that is changing. And we don't typically operate well on those two agendas because we're all sort of trying to figure out what's going to happen next and predicting the future, which we're also not very good at.
Yeah, so I think too, a lot of people's normal coping skills have been interrupted. So things like going to the movies or going out with friends and missing out on big life events like birthdays, weddings, even funerals, those can definitely add a layer of complexity to the emotions that we're going through right now. I do kind of want to add that I have seen a little bit of a silver lining with the coronavirus, and that some of my patients have been talking about how they feel like their relationships have improved because they're suffering more, so they're relying on each other more. So there is that little tiny bit of hope involved in all of this. Definitely not something we want to go through, but there is that silver lining.
Yeah. So what kinds of challenges, illnesses are you treating there at the clinic?
From a psychiatric standpoint with medications, we do a lot of depression, anxiety, OCD, and even less common things like bipolar and schizophrenia. What about you, Lyndsay?
I agree with what Kristin stated. A lot of mood disorders like depression, anxiety, bipolar disorder. We also treat individuals who have histories of trauma, whether that's a past traumatic event or a history of abuse or domestic violence. We're really able to see quite a broad range of patients, including those who might have identity concerns, our LGBTQ population. We really offer a broad range of services for a number of different conditions.
Lyndsay, I suspect some of that is done virtually right now, correct?
Yes, absolutely. Our system is very functional with virtual visits. We learned very quickly, and I personally think we're doing a good job of it. So we do have that for people who have the appropriate resources. If someone's interested, we would just ask that they call and check with us to make sure they've got the right technology. But we are also doing some face-to-face visits as well for folks who are comfortable and are really doing our best to reassure them that we are doing it in the safest possible manner that we can in the hospital system.
And are there certain age groups or risk factors that we need to be paying attention to right now?
So depression and anxiety can happen any age, especially right now. I think most ages are vulnerable to this. Certainly people who have a family history of mental health problems in their family or personal history. Once you have one mental health disorder, things kind of compact, especially now with the coronavirus. You can have anxiety and depression adding on to that. And certainly the lack of social support that we're going through right now with not being able to physically be with our friends and family.
We want to let folks know that if you or someone you love may be struggling right now and needing some help, the most important thing you can do is to reach out and talk to somebody. And if you'd like to make contact with Spectrum's Psychiatry and Behavioral Medicine Clinic, we've put all the contact information on our website at 13onyourside.com. Thank you both for being here. So important that we're talking about this right now.
Thank you. That is the other silver lining Kristin mentioned, is that mental health is drawn a lot of really positive attention right now. We want to draw awareness to it and let people know that we are definitely here to help.
Awesome. Thank you so much.